This is Ed Ryan recording. This is Ed Ryan recording audio. A case of a macular pucker treated with 23 gauge surgery using a mosquito clamp to control the eye movement during entry. This is the medial rectus muscle that I'm holding on to, and the patient it's the patient's left eye. And I'm placing the nasal cannula first. That wasn't really so much necessary in this case because the eye opens fairly well, but on patients who have very narrow lid fissures, this technique of putting the nasal cannula in first is very helpful. Notice how well you can rotate the eye downwards. You can also give it some counter traction when you've got a good hold on that 23 gauge, or on that medial rectus muscle. My assistant is holding the mosquito. I'm rotating the conj forward and with a very oblique incision, and you can see a bead of vitreous. I've got the nasal cannula placed at 3.5 millimeters. Now this cannula can be tucked under the eyelid, allowing you to have complete exposure temporally. And again, here the muscle is grasped, but I didn't feel there was a good grip on that, so I use a 0.5 to grasp the muscle insertion, the mosquito to clamp it in place so my assistant can rotate the eye. Then the infusion cannula will be placed next, again at 3.5 millimeters with conjunctival rotation. And a fairly significant angle of insertion is used. It goes in very nicely. The infusion line is placed and inspected. After that's confirmed, the assistant continues to hold the mosquito forceps to rotate the eye down, thus getting the lid speculum out of play. Here you can see the eye being rotated downwards, and the lid speculum isn't really an issue at all. And all the cannulas are in, atraumatic, and the nasal cannula is removed from under the lid.